the Small Business Programs Advisory Committee. Just to get started, and I've had the good fortune to work with many of you for a couple of years now, but I did want to kind of remind us, ground us in why we're here. These policy analysis groups, committees, commissions are so important to our state policy development process. Whether they emanate from the administration or from the General Assembly, when a group as distinguished as this group is, gets called together to work with, in this case, the Health Benefits Exchange, to develop policy implementation across the state, having your knowledge, experience, education is so critical to the development of good, sound policy in our state. And so we're thrilled that you're here. We're deeply appreciative of the time commitment that you're making. The way we'll do this is the way we've done it in previous meetings. We'll ask that during the presentations, either on the pathways to coverage or the portal design for enhanced enrollment, if you have something you'd like to add, please raise your hand in the raise hand feature of Teams or Google Meet. I'll be monitoring that to make sure that we give you your chance to be recognized. I would also ask for you all to be open to new ideas, as flexible in your thinking as you possibly can make yourself, because we all come at this from slightly different perspectives. And again, this assemblage of talent is unlike any other, cutting across all of the swaths of health policy. And so, again, we're thrilled you're here. We're looking forward to two very interesting presentations today. And it's now my honor to introduce my co-chair, a person who I didn't really know before this involvement with the PAC, but now having watched and listened to her over the last couple of years, I can't think of anybody to help lead this initiative better than Amber Hyde. So Amber, take it away.
Thank you, Rick, and I agree. It's been certainly an experience, and I'm honored and blessed to be a part of it. So thank you. So we'll do the welcome. We've done that. What we'll go over today for the agenda is the pathways to coverage. Mimi will talk about slides that she's prepared for that. And again, we've had some discussion and a lot of thought goes behind what we're going to present. And certainly we are looking for input, and I think it'll be a really interesting discussion. We'll also talk about the enhanced enrollment portal, the design of the enhanced portal. So we're excited for that too. And then we'll have open comments, and we'll have the discussion before that. And I think now we should do, I guess, the approval of the meeting minutes from the October 10th, or today's October 10th. I'm sure I don't have the date from the last one. I apologize.
Well,
or was it the October 10th meeting?
That was sent by Amelia on October 10th.
Yeah, it was August.
Right. It was actually
from August.
Actually, the August meeting, and this is John Frank. I would make a motion to approve the minutes as submitted. It's an excellent way of doing the minutes. Rick, if I point this out, Amelia does these minutes, and there's a couple technologies involved that really capture all of the segments of the discussion of the committee. So I commend her for that. But I move to approve the minutes.
Thank you.
I'll second it, Glenn Arrington.
Any discussion? If no discussion, all in favor of adopting minutes, please say aye.
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 And likewise, any opposed? Okay, Amber, if you want to introduce Mimi.
Sure, thank you. So Mimi has a great discussion on hand for today, so I'll let her take it.
Thank you, Amber and Rick. You're both doing amazing on your first day as co-chairs, and such wonderful participants with MHBE stakeholder groups. And today, as they both said, we have a great discussion in mind today for you all. we have the pathways to coverage for small businesses. And one of the things we wanted to focus on is understanding the small business challenges. And that's one of the pressing concerns for employers today in the small group market, is the rising cost of health insurance premiums. And this not only impacts the financial stability of groups, but it affects their ability to attract and retain top talent. And today we will explore some of the factors on this slide that contribute to these rising costs of insurance premiums and some of the actionable options for small businesses. And so first, inflation plays a significant role in general, and most of you all have seen this and may have been impacted by it as well, and have seen groups that have been impacted by it. In general, as costs rise, so do healthcare expenses, including pharmaceuticals and medical services. And this upward trend has directly impacted the premiums on small groups business and these small businesses. And another critical factor is member utilization or claims. And as employees access more healthcare services, the costs incurred lead to a higher premium. And we've seen an increase in healthcare utilization, particularly as we emerge from the pandemic, and we've emerged way much further out of the pandemic now, but that has a strain on the budgets of small businesses. And also, Amber and I were kind of having a discussion, and we looked at, and what she's seen on the ground as she's a broker and working with employers and individuals, is that employers want options, and they're facing a lot of frustrations with the process of getting enrolled. And so, again, one of the main reasons employers want to provide a comprehensive package for employees is to attract top talent. And there, and in Maryland, that's is extremely true. As you see, there's many government contractors in Maryland, and they compete with each other to attract the talent in the market space. So again, that's one of the items that play a factor. And then again, the regulatory environment can be complex and overwhelming to groups. And that's why they have brokers or advisors, but sometimes brokers and advisors may not understand the unique needs of small businesses, and it can lead to misinformation. And on top of that, confusing terminology and timelines can make the decision process intimidating for employers. And so that's some of the reasons as to why we're seeing some of the challenges in small businesses today. And I'll pause right here to allow for discussion. And the last item I didn't touch on, excuse me, is there's a common desire between brokers and employers to have a straightforward and an efficient enrollment process. And that's one of the things we're working on for the traditional group plans, is to allow for a simple and efficient enrollment process. And as the health insurance landscape becomes more complex, simplifying that process is essential for everyone's success. I see a hand up. So John, go ahead.
Yeah, just a quick comment on uninformed brokers and advisors. That's absolutely correct. The systems are for small employers are complex, and many of the brokers advisors that utilize the exchange their expertise is more in the individual market. So robust training on small employer plans for the distribution system is well advised.
And I think I'd like to point out, based on Mimi's comments on the slide, a lot of these things are things we have talked about here, right? So this isn't heard on the grapevine, somebody's professional experience. These are literally topics of discussion that this committee itself has raised, whether it came from our broker community, our provider community. Yeah, so I think the work of the SB PAC is what certainly has led to some of these cause statements on this challenges PowerPoint.
Thanks, Rick. And John, I think you were still speaking, but we might have lost your audio. I don't know if you can maybe log in and log out, or send us a chat if you. Okay, I think he's coming back in. But while we wait for
Glenn's
John,
got his hand up.
okay, Glenn, go ahead.
So I agree with John Frank in a lot of ways, but I also have to say that the majority of brokers that are in the small group market that have been doing it for quite some time, I would say probably it's the old 80-20 rule. Probably 80% of them that are informed and very informed as to what to do and how to help their potential client. And then there's probably the other 20% agreed that they probably, just stay outside of the marketplace and do what they do. And, they're not in the Maryland individual marketplace where they don't see all of these things, because some people don't want to play in both market space, the individual marketplace and the small group marketplace. And some try to play in the, 50+ market. But I do think that it is correct that some of them, of course, the 20% need to be informed. And that's my comment, that need to be aware of it. And I think a streamlined approach to inform, those that are in the 20% and even those in the 80% and being part of this group. I mean, that's one of the reasons why me and Amber are probably on this, and others that are brokers like Eugene. We want to provide, the quality upfront information when it becomes available. So that's just my comment.
Thank you,
And
Glenn.
yeah, I agree. I think we, especially the folks who are in this group that are brokers, you all try to inform yourselves and keep ahead of what's going on in the market space. But you also have to keep in mind there's at least 3,000 brokers in the DC, Maryland area, and not everyone is doing that exactly. And it's hard for employers to select a broker and do all of that research. And sometimes they're not doing their due diligence, and they're just selecting a broker that may or may not be able to help them in the way that they need. But did John come back? And I don't know
Yeah,
if
he's
we
back.
can hear you. Did you want to finish your
Yeah,
thought?
yeah, I apologize. I don't know. My phone went boom, dead. So I had to dial back in using my iPad. Yeah, I heard and agree with Glenn's comments. I heard those, and there's just a process with the producers that the exchange has, and you have the list of your top producers. I'd say some of those top producers are not well educated in how to serve the needs of employers, especially smaller employers, just in terms of what's required to be a business advisor type of thing. So that was my comment. So I think small businesses, believe me, have a lot of challenges. And managing a welfare plan on behalf of employees is a challenge that many of them would like to offload to a competent resource that can help them with that. And that requires education, expertise to help employers do that. So we just have to be careful there, but proper training can overcome a lot of that.
Great point, John. Amber?
Yes, so I did want to add to that as well. So in my experience, just in the past 2 months, I have taken over 2 groups that, did have concerns over the attentiveness of brokers. And I think that's, part of it too. I agree with Glenn and definitely John. We've been in this industry for a long time, and that's how, unfortunately, a lot of times that's how we gain business from, brokers that aren't paying attention to their groups, aren't sending updates. Both groups that I'm taking over had no idea that Aetna was leaving the marketplace, and then just got a letter. And I had already had those discussions with my clients. So I guess it's just really, the not necessarily the level of knowledge. It's also the attentiveness. Do we pay attention to our groups during the year? And then the other one was, I guess, just to kind of flip the conversation a little bit as well to the rising cost of healthcare. The other one, came to me because of the nonchalant attitude that the broker had to getting a 12% increase. And to them, us as brokers, we kind of get like, I don't want to say immune or just used to the terminology. So we say, oh, trend increases are 10 to 12%. We don't like when we get a 14 or higher. But we generally are, us as brokers are kind of comfortable in that 10 to 15 or 10 to 12% range. So we can have that conversation. But I think it's like our attitudes towards it as well, because for a group that is paying, $19,000 per month, if we all really understand and put that into dollars, $19,000 per month, and then you add a 12% increase on it, and to have a nonchalant attitude, towards the employer. I know that we can't really change that in small group, but maybe our attitude towards, I understand what this bottom line means. I mean, you're talking about a $255,000 cost for the employees to have coverage. So, 12% equates to $30,000. So it is a lot of money. So again, I agree with Glenn, maybe sometimes it's not necessarily our level of knowledge, but the approach that we take to these costs and changes.
That's a great point, Amber. Thank you. Mimi, do you want to pick up with the presentation?
Yes, all very good discussion. So this next, I guess, item, this next slide, we'll talk about the coverage access points. So in today's challenging environment, employers are sort of at a crossroad, as you can see. That's what that image looks like, is a crossroad sort of for employers that for traditional group plans that are becoming increasingly expensive, and businesses facing this significant rate increases. Employers are exploring alternative options to ensure that employees have some sort of coverage. And at the same time, if it's affordable, that's even better, right? So we want to create a single resource where employers and brokers can access training or resources on how to be able to access these different access points. And it may not be, well, most of it hopefully down the line will be through Maryland Health Connection or MHBE as a whole, but we had developed an outreach and education training guide that you all have seen in the past that show the clear information on solutions like the individual market enrollment and individual coverage health reimbursement arrangements, which is also known as ICRAs, which we will eventually add as a solution or as a benefit in MHC for small business. So you can look at individual marketplace enrollment for employers who cannot afford to contribute to a traditional group plan or an ICRA. They can connect their employees with a broker, help them enroll in the individual marketplace with or without subsidies. And this would just allow employers to choose plans that best suit their needs while potentially qualifying for subsidies and making that coverage more affordable. And then ICRAs are still a popular choice for employers. And through ICRAs, businesses can provide pre-tax funds to employees, allowing them to purchase their own health insurance plan. And so this flexibility allows the employees to select the coverage that best fits their needs, and they take that wherever they go. They take their coverage wherever they go. And again, like that traditional small group plans are still, one of the popular ways to get coverage for small businesses for their employees, right? And that option, we're working on improving that solution through our new portal that you'll get a flow review with Dinesh in a few minutes after my slides are done, but you'll see, how we're trying to improve that solution as well. So these are the different options. I do see a few
Yeah,
hands
a
up.
couple. Eugene's got his hand up. Go ahead, Eugene.
Yeah, I ran into another issue with small group versus individual. Many of us in the field are looking at it from the perspective of, well, these premiums are so high. Maybe the best thing for me to do is help them get on the individual program. Now, let me tell you something that was interesting. Here's what threw me off really incredibly, and that is in vitro fertilization, IVF, in many of the small business settings are generally not covered under 50. However, if you go to the individual market, it is covered. It is counterintuitive to think that. But what I found was that one of my Care First clients said, hey, we can sell you the in vitro fertilization if you go to the individual market and leave your group market. I don't know how many brokers run into that, but I ran into that in particular because this person was trying to have a child. The owner of the company was trying to have a child. And she asked me, she said, well, can I do it under the small group? No. But she contacted Care First, and Care First said, yeah, you can't do it in the small group, but you could do it in the individual market. So that's another challenge we run across. These are these little known kinds of things that are going on behind the scenes because they're under a different set of mandate in the individual market that is not in the group market. I don't know how many brokers run into that, but that was a surprise to me, and I ran into that fairly recently, where I found that we could do something in the individual market that we could not do in small group at all.
It's a great point. Glenn, you had your hand up.
Yes. Regarding the ICRAs, I just wrote an ICRA policy for the first time. And, my understanding and what Task and some of the other, ICRA carriers or vendors that are out there, it has to be a client in order that actually does not qualify for the federal or state subsidies to be able to enroll in an ICRA plan. They can't get the funding from the ICRA. They can get it, but they can only get it on like to pay for deductibles and copays and things like that. But they're not able to get, a combination of money to pay for it, plus the additional federal, the federal subsidies. So it does make it a little bit challenging. I mean, you got to find the right client for it, and, to go into the small group market. And most of those aren't going to receive the tax credits if they're earning that kind of income. So it does make it very complex. I know Eugene just brought up a point, and, for me as well, you have to find the right client for the ICRA. But I know they are picking up more momentum simply because of some of the things he just mentioned, and because of the fact that the small group market rates are higher than the individual rates. So, so that's the balance we all have to play as brokers. And you're working into basically three different models, actually a fourth. If we bring into the equation, the partially self-funded products. And if we bring in the fact that if these PEOs pass, then we're going to have a fifth potential situation to deal with. So it's very complex for sure.
Yeah, it certainly makes the point we were talking about earlier in terms of informed brokers. John, you had your hand up.
Yeah, I really like the graphic of roadway infrastructure construction. It would be interesting if you look at the route to traditional group plans and they start to turn red because the rates are so high. And then what are the alternatives as exits from that pathway? And it's the individual route or the ICRA route, or as Glenn mentioned, whatever happens with PEOs or the partially self-funded route. Okay. But I just think that, that picture says a lot. If you think of it in terms of where roadblocks may come and where pathways to success may exist. So that was my comment on it.
No, that's great. Thank you. Our friend Stephanie Clapper with Maryland Healthcare for All has her hand up.
Thanks, Rick. I was just wondering if, along with IVF, if there are many other services that are covered in the individual market that are not necessarily required to be covered in the small group market, if anyone knows the answer to that.
Amber, go ahead.
Thanks. So when we talk about IVF not being covered in small group, it doesn't mean that all IVF is not, like all procedures through IVF are not covered. So there are other alternatives. I did want to mention there are like other alternatives, and some of the policies and benefits are different. I think Glenn will agree. In the small group market, so you do have other pathways. It's not just a hard IVF is not covered. But pretty much everything else, to my knowledge, is equivalent between the individual and the group market. Glenn and John, would you agree?
Yes, it's in vitro and in vivo fertilization are the differences, and
Right.
the one that's more expensive is, of course, the one that usually is not the one that's going to be covered in small group, but large group, and that's what Eugene's referring to. And then another comment, on the flip side, traditional small group policies have, in some cases, better prescription coverage right from the get-go compared to the individual policies, where, in some cases you have no deductible at all, and you have first dollar copays. Now, of course, they're in the platinum or the gold type plans in traditional plans. So, it is a balancing act as to, your client, what their needs are, what the kind of investment in money they want to put into this. And that's really what it boils down to. And I think we're attracting that 1 to 5, we call them the micro groups, maybe up to 10 employer group sizes is what we're really dealing with. But at times, you'll run into some contracting companies and some companies that are, they do pay very, very well. And on top of that, now they're going to have to start dealing with the family medical leave insurance. That's another item that's coming down the pike that, I'm helping my clients out with in advance. So it's a lot of moving parts for a small employer, and they need people like us as brokers to help them stay ahead of the curve. So, yep, I would agree with what Amber said as well.
It's a great point. Johanna gave us the courtesy of dropping the MIA essential benefits chart into the chat, so you could print that PDF out if you wanted to do that. But
I was
that
just going to
helps
read
address
that out. Sorry, Rick, I was going to read that out. It
No,
says
go ahead.
coverage for services obtained after diagnosis of infertility is covered in the individual market space, but it excludes in vitro fertilization for small group, and that small group plans exclude in vitro fertilization, but is covered for individual plans. Actually, that was the last column, the comments. So it is explicitly excluding small group coverage for IVF. Yes,
Amber, go
Amber.
ahead.
Thanks. And that should be specific to in vitro. And what the point that I was bringing is there are other avenues, like Glenn said, you have like in vivo, and you're really getting into like a lot of other details to where an egg is fertilized and where it enters the body. So we had, extensive training with that back in the Mamsie days. So I think that there are infertility options that are available, and maybe we can bring that up as far as like specific items. But I know the carriers don't like to pre-qualify any of that, but I know that we did have discussions and learned about the different infertility options in the small group market. And I think that's what we were both saying.
Yes, that's true. And that all makes sense. Yes. And there are services that, that small group has that individuals don't have. For example, wellness services, and we talked about this in a previous meeting where, wellness incentives are so big in small group, but not so much in individual. But yeah, so I just wanted to point those out. And ancillary products as well. If you look at, I believe dental, and I'm not sure currently, but I know in the past there was dental preventative services for adults and not so much for individuals. So it just varies, I guess, in either market spaces, how much level of coverage you get for essential benefits. All right, so we can move on to the next slide, and final slide around this topic. And I guess this is a timely discussion that we're talking about these different access points and different options for employers, because we do have our open enrollment for the individual marketplace starting on Friday, November 1st, and ending on January 15th for a January 1 effective date. And I think it's safe to expect growth in the individual market space, continual growth. There's a lot of progress that's been made policy wise and plan management wise, and as well as IT wise, especially on MHC, not the off exchange market space. Can't really speak to that and the different things that are happening there, but there's also a new carrier that entered the individual market space, WellPoint. You may have heard about it. And that also increases competition, which is great for marketplaces. But we also have to look at some of the obvious reasons, like the enhanced subsidies through ARPA, the Inflation Reduction Act, and lower premiums in general. If you look at without subsidies, if you look at the individual marketplace and the small group marketplace, premiums are cheaper on the individual marketplace. So that could also be an attraction to that marketplace for businesses. And also, again, looking at ICHRA's popularity in that members are, from small group, traditional group plans are kind of going in different directions. And so that could be adding to the popularity of the individual market space. And one last note I would make is that Johanna passed this to me a few weeks ago, and I wanted to add it here, that the Treasury Department analyzed tax and tax information, tax returns for the tax year 2022. And about 25% of marketplace enrollees in 2022 were self-employed or small business owners. And I thought that was interesting to share here, that that's adding to, again, the individual market space growth.
John,
Sorry, Greg.
you're good. Go ahead, John.
We can't hear you.
I'm sorry. I was going to say, on the 25% of enrollees being self-employed or small businesses, I can't say I'm surprised at that number, because traditionally, if approached by a small self-employed business, the first question would be how are you taking care of your family and you, as opposed to all of your employees, because adding that expense to newly forming businesses is a tough go. And that solution is going to lead them most likely to individual coverage on the exchange with subsidy, because they're not making any money. So that would be my observation on that. I don't think that number is too high. I think in that range of prospects small groups up to 5, 10 employees. You're gonna find many employers that are not offering that benefit plan because they may have even gotten advice not to go in that direction just because of all of the cost and increasing cost and administrative burden they might find.
Absolutely. Makes sense. All right. So before I move on to this and introduce Dinesh and Sachin, I kind of forgot something in the beginning of the meeting. I forgot to introduce Sarah Mayhew from UHC, who took over Michael Raczewski's role, or I don't know if that's his role. And Sarah, you can correct me, but I know you're taking over his position on this committee. So, would you like to introduce yourself and say a few words?
Sure. Good afternoon, everybody. My name is Sarah Mayhew. I am the Director of Sales and Account Management for United Healthcare's Small Business Sales Division, which is our 2 to 50 specific segment. I have been with United Healthcare for almost 20 years. I've worked in a bunch of different markets. I live in New Orleans, Louisiana, but my team, again, supports the Mid-Atlantic. And as far as, yes, taking over Mike, they basically had us in 2 different roles. I had the sales and retention role, and he had more the strategy roles, and then it was sort of combined. So I'm taking over both of those parts. So anyway, thanks so much. I'm happy to be here.
You're an important
Thank
partner,
you.
Sarah. We're happy to have you.
Thank you. Appreciate it.
All right. So thank you for that, Sarah, and welcome. And I will now pass it to Sachin to just give us a quick update on our project timeline regarding our new billing and aggregation. I'm sorry, not billing and aggregation. Sorry, our enrollment portal that we're building for fall 2025 launch. And then followed by Dinesh for the portal overview.
Yeah, sure, Mimi. So good afternoon, all. So we are actively working on developing our enrollment portal. Most functionality related to employers, employees, and brokers has been completed, and parallelly, we are also testing what has been developed so far. Of course, there are certain areas where we need to focus on to move them to completion, in addition to integration with our billing vendor NFP, with whom we are actively working on hashing out the requirements. So considering these facts, we revisited our timeline and modified a few dates. Most noticeably, we extended our internal development date to Jan 31st, and with reference to integration with the billing vendor, we extended the development date to April 30th to kind of sync with their development cycles. However, having said this, there is no impact on the go live date, and it stays the same as before, which is fall of 2025, to be specific, September 1st. So maybe that's all I have. I mean, from the updates point of view.
Thank you. I appreciate that, Sachin. Does anyone have any questions for Sachin about the portal timeline? All right. We can then now move on to Dinesh's demo.
All right. Thanks, Mimi. It's a short time now.
Yes.
Let's,
And we appreciate you. Thank you.
yeah, let me share my screen. Right. You all see my screen? Just want to make sure.
Yep.
Okay. So I don't see any chat. If you're raising a hand or anything, I won't know. So please stop me. Hey, Dinesh, stop it. And
We got you.
Okay. All right. Good afternoon, everyone. Today, I'm just going to give you a walkthrough on the renewal plan experience. So if a small business owner comes in on, let's say, a week before November, right? Or the specific term when they have to renew the plan, how they will walk through in the system, and the system, how it guides them to renew the existing plan, right? So this pop-up, it comes in for the specific period. If it's a renewal period based on the business rules, as soon as they come in, it just the pop-up shows, and it gives them 3 different options. One is they can review and update the benefit package, what they have right now, or they can change it. So this is basically they can just review of all good. I just want to retain assets. The second option is I may need to change it. It's expensive. Maybe I need to go for a lower plan or higher plan. Depends on their preference. Then the third option is, hey, I don't want to do anything right now. Just put in, right? So this way, if they choose this option before the enrollment period, then enrollment period, the system expect for them to manually come and do it, right? Because the system is not going to auto-renew them. So automatically it can get canceled. So that is that third experience is for. So let's go through the review and renewal experience. So when they click on it, the first thing we clearly show them is what the plan that they have currently. So as you see this design, we specifically call out what plan they have and how much pricing. So all the numbers that we have here is just for the markup. So what you are seeing right now, it's a markup experience. It's not the real dollar per se, but that changes based on the plan. So this experience is to show them, they are having a Kaiser Gold plan, and if they want to change, they can change it. That will take them to the change experience, which I'll show it later. Or they can just scroll up and down to see that information. We kind of presented this information, what they have to say. So in terms of, here is the plan, it has all the contribution information and what is being covered. And of course, if the user wants to know plan and cost, prescription drugs, all the detail they can drill down if they want to say it. But these are high level information, of course, any business owner wants to see. Then specifically, we are calling out on the contribution amounts. How much is the total cost per month, and how much the employees will pay, and how much as an employer I will be paying that specific dollars amount, right? Now, when I just say next, then just a 2-step process. The enrollment.
Before you move on, Amber had a question on your last slide.
Okay.
Hi, Dinesh. Just a quick question. So in this on these slides, is this showing an equal contribution to all plans? A lot of times the way that we work with employers is they may pay the contribution towards a base plan, and then employees would pay the difference to up to a higher plan.
That is correct.
Okay, so this is in this explanation, it shows 50% per se of all plans. Are we going to design it to where we can say 50% of the base plan, and then an employee can pay the difference for a higher level plan?
Yeah, so the coverage model, this is what you see here. This is what it communicates. Coverage offering employer choice plans offered by one company. Then the coverage model also plans offered across all companies' plan.
Thank you.
Yeah.
Please go ahead.
Yeah. So I have a question. This is John Frank. I have a question.
John.
So is this the first opportunity the employer is having to see their renewal rates to renew their plan? Is this the first opportunity they're seeing, and they're getting it in this manner? Is there anything proposed that shows the increase? They're paying a certain rate now, and this is predicated on the same information that you have, but a new rate. But it just doesn't give the employer much information about what that rate of increase, what he's dealing with regards to that increase on his budget as part of this initial informational snapshot.
Yeah, I see what you're saying. So you're saying, even though I'm planning to go with the current plan, what if the price changes? Is that what you're asking? And
price change?
Well, how we are communicating it? Probably, I don't have that experience right now, but the experience I will show you in the next flow, where we have a similar one, like kind of a change where we compare what you have now versus what will be new. So that is where the change plan, so you can think of like a change plan, right? Because this plan is no longer offered. Right? This is the plan, no change, same thing being available, then how the experience is, so that they just review and confirm it.
And
But yeah,
sorry,
go ahead.
Dinesh, I just wanted to add a point here. The groups will also be receiving a renewal document, not only just from us, it's a notice that will be from us, as well as the carriers that let them know, these are your options to renew. And if they renew into a new plan, then they can come into the system and change into that new plan, and they'll see that in their summary. And then we'll also see that once they're actively renewed back
Yeah,
into their
I
dashboard.
see. So this is not intended as their first look at the renewal.
This is the first look at the renewal for their existing plan. Yes, for the current plan that they have, if that's the KP Gold 6150, that's what's going to show up. But they have an option to change that renewal, and I think Dinesh will show us how they'll be able to change that, right?
Yep.
Okay.
Glenn
Okay.
also had his
Thank
hand.
you. Thank you.
Yes.
Go ahead,
So I stepped out for half a second, but to me, listening to what everybody's saying, I thought this would be like, okay, this is my brand new account that I just set up, right? And I'm just starting for the first time enrolling in a plan. This is what the cost would be for open enrollment after I've decided as the business owner to enroll in a plan. And you can stagger it. It's not a calendar year. You can do it any month. The only question I would have is like, for an employer, when they're age banded as well, each employee is going to have a different premium amount. So, based on the age banded rates, right? So if I missed that, I apologize. But I guess that's
Yeah.
kind of the point that also some may do percentage of premium of, let's say, 50% of the individual. Some may do, percentage of the dependents. Some may do a fixed dollar amount. So the system has capabilities of all of those options.
Yes. I will. That's the thing. I will go through that experience. So
And I
that
just wanted to add to Glenn's original question. This is a renewal flow. It's not the initial group setup.
Okay. Well,
Yeah.
thanks for the clarity. I missed that part. I had to step
No
out for a
worries.
call. I apologize.
correct.
No worries.
This is the context is this is a renewal plan. The user is not interested to change any of the plan, and there is no change in terms of price, right? So how the experience is. But coming back to the change plan, that is when all the option is presented to the user. If they want to change different contribution level, different plan, they could change it. That will go through as a next experience.
Go ahead, Amber.
And I'm so sorry. So this will be a portal that us as brokers will access first. Well, like we would get notification that this is available at the same time or a couple days before. Generally, we get the renewal just a little bit before the group so that we can have that little buffer, week or 2 weeks to kind of view it, start brainstorming. So is that possible to have it released to us just a little bit sooner than to the employer?
I can answer that, Dinesh. Amber, we're planning to start reminding the employer that they're coming up for renewal well in advance. I believe it's like 90 days out, which is much earlier than what most carriers are doing. I think it's a 60-day in advance renewal notice for carriers. So at that point, you'll have the option. You'll see the notice from and you will have access to the employer's dashboard just the way you have it now, but with more, obviously with more features like the enrollment and renewal. And you'll see exactly what the employer sees. And so you'll be able to come in, access their inbox, and you will also get a copy of their renewal document in your broker inbox, and you'll be able to take action from there and reach out to the group.
Thank you.
Go ahead, Dinesh.
Yep. As a user, now I go to the next screen. So here, I have an option to turn on and off the auto renew plan. Then I can quickly glance over all the information, that reference plan which I just selected. Then of course, if I have a number of employees, I can see what is the cost going to be, the overall cost. I can quickly take a look at it for the entire the employer profiles. Then when I click on the button, that's it. So just a two-step process. Now again, I can go back and look at all the information that I want to see. Any questions on this flow? Okay, so I need to go back because of it's a prototype. Let me start again. So the one first we went through that experience is just review and renew, right? Just a two-step process. Look at the current plan, then the second page, just a confirmation on the plan, and also in the employee details and how much they are contributing, the summary, then sign it. That. Now the change benefit package. So this is like, I have this plan, but I want to change it, right? I may want to choose a different plan. So all these things based on these settings, this is the one which you talked about, right? How much I want to pay based on my employees, how much they want to contribute. Maybe my number of employees might be changed. So I want to choose a different plan. So I want to compare and contrast based on number of part-time employees or contract employees, whatnot, right? All these, so similar to your purchasing a brand new plan, right? Same experience, but in this case, I already have a plan which is being covered. So I'm going to choose now, assume like I'm choosing this plan. So I choose this plan. Now I go to the next screen. This is where we are providing the, okay, this is what you have, this is what you have selected, right? So we are just comparing side by side the current plan versus new plan, because of course the user can go back and choose another plan to come back and check in the screen. So this will be a great help for them to see whether they need to go with the new plan or not. Then when they click on the next, they will see the similar experience like the previous one with what plan they have selected it, then what is the contribution amounts. Then finally, they will see the summary with the breakdown of the employees and how much they are paying, etc. Then complete the flow. That's how it is. So if you can look at the overall experience-wise, right? If it's just a renew, just a two-step, but if they are changing the plan, we are just adding two other steps. First one is select the plan that they want. They can apply all the filters based on the contribution level, the number of employees, and other filters as needed, right? Then they can select it. After selecting the plan, they can see the price difference. Then same thing, like they confirm it. They verify all the employees, how much they are paying. Then that's all the second flow. Any questions before I move on to the next one?
Amber, go ahead.
I'm sorry. And I don't mean to revert back, but so in this, say if they have, if it's employee choice, they're going to have two plans for each carrier. And say if they just want, if the employer is paying a percentage or a dollar amount towards the base plan, will there be a space added to show what that amount would be towards the additional plans that the employee can buy up to? Or will it have to be across the board? Say if they do, I have a client now I'm working on, they pay 70% of the base plan, and then the employee can buy up to a higher level plan. Will this model, is there room to be able to add that? I know it kind of complicates things, but that really is a scenario that a lot of companies use.
So are you talking about more on what is being covered or how we are communicating to the employer?
Both. So in the renewal, say if they have an employee choice, so they're going to have United Healthcare, Care First, and Kaiser. They're going to have two plans each. And the employer says we're paying a percentage, we're paying 70% of the employee's coverage on the base plan, but if the employee wants to opt up and pay the difference to a higher option plan, they can do it at their own expense. So my concern with this is this model, it looks like it's just going to show, you know, your percentage towards the employee, towards the family, and it would have to be across the board, no matter how many plans they have, versus them having the option for the employee to buy up. That might be a little bit confusing. And I know Glenn and John, I'm sure we probably all have that scenario where the employer will offer a base plan and they'll say, we'll pay, 70, 90% or 100% of the base plan. And then if you would like to buy up, here's an additional plan that you can buy up to at your own expense.
So that is being communicated in a different way. So right now what you are seeing as an employer self-service experience, right? So me as an employer, if I sign in, I choose the plan, then I kind of, because you are right, even though I'm saying for employee one, I'm paying like $83, but now the employee can go up and within the same carrier, they can choose the higher plan, right? Because they don't need to choose the reference plan, they can choose the other plan, but as an employer, I will pay that is the maximum level, right? So now what we are trying to communicate in this is, hey, you have 10 employees, see, based on your 70% what you selected for the CASER, this is what your your estimated premium cost per month.
Yeah,
That is
you're doing a great job explaining that. It's basically the concept of a reference plan, and that's built into the system, whether it's a new group or a renewing group. One thing I did want to see, Dinesh, is I don't know if you showed whether the group can change their reference plan, and if that's something, maybe that's what you're about to show at the renewal point.
Yeah. Yeah. So this one, do you all see my screen?
Yes.
This one, for example, this is what I have right now. So it's showing based on what I have, we are showing like, okay, these are similar plan that user can choose it. So they can select any
and
of
with
this.
the silver and the similar plans, we're going to show all plans, but these are like what similar to what they currently have, and that's what's going to pop up first.
Correct.
Yeah.
And this will have, like, you can think of like if you have 20 different plans, all the 20 plans will display in the same page. It's like highly scrollable, and they can choose by the name, or they can sort, the whole different experience being built to show that.
Okay, and just wanted to see how they changed their reference plan.
Yeah. Okay. When you say reference plan, just a selected, or you are talking about?
Okay, so this is under the reference plan. So this flow is showing them changing the reference plan, because I see that you're selecting this plan. Okay, so yeah, so maybe we don't have a flow where it's showing what the old plan was and now you're selecting a new reference plan. It's just showing how you select a reference plan, basically.
Right. So do you want to see what was selected versus what being proposed, or I'm trying to understand?
Yeah. So when a group comes up for renewal and they have a reference plan already in place,
that's for the employee. You are also talking about the employee experience, or employee?
The employer. If the employer at the renewal time is trying to change the reference plan, I just wanted to show that flow, but that's okay. In the interest of time, and I see Glenn has his hand up, we can just discuss that offline.
Go ahead, Glenn.
So most companies, when they come up to renew in small group, we as brokers create like a spreadsheet and put side-by-side plans so they can see what their current rate is, what the renewal rate is, and then see like alternative plans. I don't know, from what I was seeing, it was almost like you're changing the reference plan, but you're not able to see them in a quick snapshot of what the overall cost would be by showing similar plans, unless that screen you just didn't get to yet, the show. I didn't see that type of a comparison.
So comparing, the way we are showing is after you selected, we are showing compare side by side.
And how many can they see side by side? Is there a certain amount? Obviously, in a spreadsheet situation, usually if you had like 6 different comparative or 8 comparative plans, or you can spread that. Can it be a spreadsheet that can slide back and forth, or how limits?
That's a very good question you asked. The idea is you can have probably 3 to 4 if I'm trying to remember. So this current plan in this screen, probably I can build and show it next time. So the idea is that this current plan, what you see, it'll be sticky. So it's like an Excel sheet you can think of. Like the new plan, if you have a 2, 3 things, that will scroll left and right. So you can scroll. This one will be just a sticky in your screen, similar to Excel sheet. Like you can freeze the column, right? Then you can scroll left and right your additional columns. That's how it is. So you have your current plan to compare with all other plans. Let's say in this case you have Kaiser MD Gold. Let's say if you selected Kaiser Platinum, Kaiser Silver, then you can just scroll left and right to compare what you have versus what you are planning to add it as your reference plan.
Right. So you answered my question, but like I say, depending on how many limits you want to look at that are comparable, and if you have, basically 4 carriers in the market, you'd have a similar, maybe at least 4 or 5, if that's what you're saying. But then if you're going to compare a couple different options, I was just curious what the limitations would be upon that. So thanks for, I think you've clarified it. You said 4 or 5 would be able to be shown like on an Excel spreadsheet. There'd be a slide back and forth.
Yeah, that is correct. That's why you see here, we have an option for the user to select and compare. Same thing they can select. So that option is provided, yeah.
Eugene, did that answer your question?
My question has to do with, can we present it in Excel form? Because I think most people are using an Excel format for something like this. So if they need more than 4 or 5 choices, they can have 10 to 20 choices. That's currently the technology that we use today, is that we automatically have an Excel version that shows side-by-side comparisons. Can that be done easily with this situation?
Yeah. Okay. So from the experience side is same. Like you can think of like each one of this as a row. This is like a column.
Yes.
Yeah. So it's literally same. That's exactly what we built when we built it. But the only thing is, rather than the small tiny Excel sheet, so we can add as many data points we wanted it here. So that is enhanceable. But the thing is, we want to really call it out because it's a self-service. Of course, it's for the employer. Yeah, probably when we build this for broker, probably we can see if we can accommodate that with the Excel experience. But for the employer experience, the thought process is how we can simplify this information in a better representative from the visual perspective. But the experience is same like an Excel sheet. You can think of like, you can scroll up and down. If you have multiple columns, you'll have multiple columns to go left and right.
Yeah, I mean, because that's what I currently do today. Currently, I have a presentation that may look like this, and then it'll say, you want to see it in Excel format? You say Excel format, automatically converts into Excel format for us. That's what currently happens today.
Yeah, I think what we'll do is probably add that as an enhancement. It may not be available at Go Live, but
Yeah, I got
we
you.
may have it down the line.
Down the line, some new enhanced deliverable.
Right.
Sure. But that's what we do today. That's why I mentioned it.
Okay.
We do have the ability to print this. I know you can email it to yourself. You can print it. Even in today's environment, we have those capabilities, but I don't think we have the Excel format available. But we'll add that as an enhancement.
Thanks.
Yep. Yep. Good point. Thank you all. One last experience on this. And anything else before I go on to that? Okay. Okay, so this one is just canceling it. So you can think of like the user come in, he's saying, hey, I don't want to renew this. I will, when the enrollment comes, I'll talk to a broker or I'll do it myself. So when they choose that option, we clearly calling out here, if they don't take that action by the specific date, their plan will be canceled. And all their associated employees, will receive the notice and, they'll lose the coverage too. Right. So then, in this, we are just showing that reference plan, what they have. Then they just confirm it, just a one screen. But however, we confirm again, once again, we are, once again, we want to make sure they didn't do this by mistake. So we are asking them to confirm it again. Then once they confirm, that's it. But the thing is, like, since they cancel it now, when they come to the landing page, we always present them that option. You cancel your plan to continue your coverage, you must reapply as a new business. That's how it is. Okay. All right. So this is for the employer experience. Now I'll quickly go through on the employee experience, right? So now the employer came in and created a new plan. But when the renewal period comes, when the employee comes in, how they pursue that option. Before I move on, any questions on the employer flow?
Go ahead, Amber.
Thanks. I don't have a question, but I do have something I wanted to say. Eugene, generally when I reference John and Glenn for the broker opinion, I am just so used to doing that because I've known them for so many years, but obviously you are in the group market as well. So I apologize for not mentioning that. And I know that you are just as experienced as we are, and you do group plans as well. So I apologize, and I want to let you know that I'm not excluding you, and I just didn't think, it wasn't in the front of my mind that you work with groups as well as individuals. So please accept my apology.
Amber, no apology required.
Thank you.
I understood. I mean, you work with people you work with. That's all. It's nothing personal. It's just these are the people you work with. I understood that from day one. So it's
Okay,
no problem.
good. Thank you.
Yeah, if Sandy were here, we'd have to have included him too.
Yes.
I did want to say before we also move on, if the carriers have any input on as to what you're seeing, you have a different perspective as you hold these groups and you have to administer them. So from your angle, if any of you have any input. Okay, we can keep going then.
All right. So now this is going to be an employee experience. So employee comes to the dashboard. They are presented with two options. So when they come in on, say, November 1st, right? The first thing they'll say is, okay, your annual enrollment period is now open, so they can renew coverage or waive their coverage. Both options are presented. So when they start with the renew coverage, this is where we are just showing that user. This is what the employee has versus what the employer is asking them to choose, right? It's an employer reference plan. So we clearly call out if the employee has chosen the same plan as the reference plan, then this will be the same plan. We'll just mark it with the current plan, right? So they have an option within the limit, whatever the employer chosen, they can go and check. Similarly, they can compare similar experience. Then they can decide what they want. Once they make a decision, either they can go with the assets or they can choose the different plan that they are interested in, right? Then as soon as they choose, they can, we just confirm them what is the plan they have selected. Then that's it. Just a two-step process for very simple, easy steps process for them to confirm their enrollment. Then for the waiving the coverage, waive my coverage. So when they choose that option, we are just asking them to choose why they're waiving the coverage. So they can choose one of these options. Right now, I just have this, then confirm it. That's it. Okay. All right. So this is the employee perspective. If they sign into our portal during the enrollment period, what is presented in the landing page, we clearly call out the deadline for the enrollment and how many days left. Then, of course, this is all again once again reminder. Then, if you see a part of the landing page today, we pretty much show them all other information that the coverage that they have. You know what the plan they have, who is covered, their employer detail, broker detail, all the other information is there. But this is just a specific to the renewal experience. So they come in this banner, they can always hide it if they want. But this banner will be coming to them during this enrollment period. Then they can make a quick renewal with just a one click. So we are kind of looked at how we can show the information and make things faster. Okay. All right. I think that's all I have.
Amber had a question for you, Dinesh.
Yeah.
Thank you. Yes, and obviously this would be available to the employees after the employer and the broker have decided on the plans that will be offered, correct?
Yes. Yes, you are right. That is correct.
Any other comments, questions, thoughts, observations on Dinesh's presentation? Dinesh, thank you very much. It's I think it's very intuitive. It's a great design, and we appreciate, as always, MHBE's openness, willingness to make changes or adjustments, certainly to accommodate our broker community.
Thank you.
Thanks, Dinesh. All right. So moving on, we just have some questions and discussion items. And we may have already sort of covered everything, but just kind of, it also serves as a recap of everything we've discussed. So considering our discussion on the pathways to coverage, what collective actions can we take to assist small businesses in Maryland in securing affordable health insurance for their employees and reducing the current uninsured rate of 6%? And we have some notes in here about, and this is Amber's great contribution about MLRs under the ACA, that insurance companies are required to spend a certain percentage of premium dollars on medical care and health services rather than on administrative costs. And so if an insurer does not meet the MLR requirements, generally 80% for individuals and small group plans, they must provide rebates to policyholders, which can include small businesses. These rebates help the overall costs for employees and their employers and their employees. Sorry. Glenn.
Yeah, that also gets very complex when it gets to the bottom line of all that and how to distribute that to the employer based on their contribution. So, and including those that had left that may have been part of the plan. So it's a complex thing, but I think that probably covers the basics, but it'll open up questions, I'm sure, that maybe, I don't know if that's going to be included somewhere, like, like a little box that would say questions and like give it a drop down to explain a little bit more about that. I don't know how in detail we want that to become, but it's pretty complex.
And I wanted to add that I guess we're specifically looking for solutions as to what MHBE can do to make a dent in that uninsured space. So, that's sort of what we're looking at. But, Amber and I were sort of like discussing about MLRs, and that's one way that, groups see some of their money back, or, and wellness. I think we discussed some wellness features as well. But yeah, I think it's an open question that, we need to consider, as especially in Rick's opening statement, as he said, how we're trying to accomplish a common goal here.
So on a kind of hyper local basis, and I'll use Maryland Saves and the whole conversation surrounding 401ks as an example. Here at the Frederick Chamber, with our 980 corporate members of this chamber, we did a series of lunch and learns with our local broker community. And in fact, we've got a couple more scheduled, where the brokers are given a chance to meet with 90% of those 980 companies employ fewer than 50. 90% of my members employ fewer than 50. And the vast majority of them employ fewer than 20. So I feel like they fit right into the band that we're worrying about. So we've scheduled a series of lunch and learns with all of our broker community to be able to meet with these employers and, to a lesser extent, employees, to walk through this process, just to demystify it, to make it easier to comprehend, to get a better sense of where the employers are in terms of what it is they can and can't afford in terms of benefits and compensation, specifically surrounding this topic. If we can get my 39 counterpart local and county chamber CEOs across the state to do the same thing with their broker communities, I think maybe that's one way we can quickly get to a point where we're taking a bigger bite out of that uninsured rate.
Go ahead, Amber. Thank you, Glenn. Rick, that was great. Yeah.
Thank you. And I guess this, is kind of similar to what Rick just mentioned about what would be the possibility of, I feel like there's such a disconnect between our groups that are actively working to try to bring this, cost down and the legislative sessions. I mean, what would be the opportunity that we could have guest speakers or people, our county council people join these meetings to really hear? I mean, I feel like, we all say it's so expensive, but we really don't have a gauge on what it actually costs for a family to pay $2,800 a month for health insurance for their family. That is a mortgage. I mean, we all swirl around, it's so expensive, but when you put that dollar amount to it, and I feel like if legislators could really see actual numbers and be involved, I mean, what is that possibility? Maybe Johanna or someone can see what the possibilities would be, maybe.
Yeah, and I think Johanna had to drop off for another meeting, so it would have been a great point to bring up while she was here. I think we can bring that up to Johanna and Michelle and get some feedback. But that's a good point. And I see Glenn. You still have Glenn, and then Eugene.
So I think it might have been a couple of years ago when NAFA Maryland and NABIB were invited for a meeting down in Annapolis to do Insurance 101 briefing. And I was one of the guest speakers there. And it really was eye-opening to some of the legislators there, the delegates that were there. And, we covered, you could only cover a brief amount of information. And, there was the Maryland, I think, Insurance League, the Maryland Insurance Administration was there, and also it was also, what was it, the Maryland Health Benefit Exchange. You all were there, so it was kind of interesting that we kind of tied it all up with like how the broker John and I spoke about it, and I agree. I think our legislation needs to be more aware of this. I think what stemmed from that is they attempted to get, with that work study group, Amber, to have, subsidies for small group, but it would have cost, I thought it was somewhere in the neighborhood of $170 million to help give maybe 10% back to, at the time, whatever it was, 350 or however many people were in the small group. So, but I agree that as much pressure as you put on it, it's just a number that healthcare costs just keep going up. So it's a very difficult situation for sure.
I did also, before Eugene goes, I wanted to mention that our board is having a retreat next month. They call it a retreat, but it's really a meeting. It's at the South Branch Library in Prince George's County. And at that meeting, we're going to have several panelists, and for small business, the focus is on small business for about an hour and a half, and we're going to be discussing that. And I think bringing these issues that we discussed today to that board. I know several of you, about 4 people from this committee, will be on that panel to discuss these items that we discussed today, and to try and see what can be done, and at least bring that issue at the forefront of our board members as well. I think that's a good place to start. And then if at some point down the line we need to bring in legislators, then the board could advise us of doing so. And with the board's support, we can be a little bit more successful in doing so. But go ahead, Eugene, and good point, Glenn.
Yeah, I just want to mention one other thing, and that is small employers that are government contractors. One of the things that I work with a lot of groups is the pricing when they get a federal contract, when they're coming as a subcontractor, because these folks, the fringe rate right now for GSA and Department of Labor is $5.36 per hour is what the small group can bill the government, where the government is really reimbursing them for the health and welfare benefits. So a lot of people that I work with happen to be government contractors, and I go over that fringe rate. That's really important because that covers most of the costs for their employees, if not all of it. So $5.36 per hour based on the 40-hour work week is quite a bit of money. And so when I'm talking to small groups, this is one of the strategies that I use in consulting with them to say, hey, listen, you want to be a subcontractor with a big major contractor, their contract rules flow down to you as a small business. So you should be billing that same $5.36 per hour to cover the health and welfare benefits. So what I'm finding is that a lot of my groups will be covered under that rate reimbursement that helps them to pay for the health insurance. So that's different from someone being a dentist or having a small restaurant. But I find that because we're in the DC area, we have a lot of small businesses who happen to be subcontractors on large group contracts. I'm going to make sure we brought that aspect in there into the picture as well, because that's one of the things that I use. And when I pursue small business, I say, listen, if you go after a government contract, federal, state, municipal type contracts, this is the other way to get reimbursement on a monthly basis. Not, it's just a big part that people are actually missing.
It's a great point. And Mimi, I wrote Glenn's issue down, and I'll certainly volunteer to bring it up when we meet with the board next month.
Sounds good. Yes, that sounds great. I did want to move on to the second item, and then I have one update that I wanted to include for everyone, but let's just get through the questions. Are carriers offering composite rates for small group policies, and are these composite rates offered on exchange plans? I've had a few brokers contact me and say, there's a policy where you can sell off exchange where they wouldn't provide composite rates for, the carriers wouldn't provide composite rates for if it was on an exchange. And I think the TPAs were doing the same thing. So if there are any carriers here that could address this or would like to speak up on this topic.
Hi, Mimi.
Go ahead, Nikki. Sorry.
No, that's okay. Yeah, this is Nikki from Care First. I think we've sent in writing before that we don't offer composite rating on exchange, and we only offer it for groups that have one medical option.
Okay, and that was, sorry, go ahead. I'll let you finish.
Ours, we can do 1 and 3. We can do composite rates with 1 and then composite rates with 3 for whatever reason. And I was under the understanding that it was a state mandate that you had to do age banded on dual option.
Okay.
Actually, I was told from Kaiser Permanente and that in small group, they would be willing to do it with more than one plan. But I was under that same impression that it was a state mandate that Care First and Aetna did not allow it, but Care First and United would do it. And of course, they can do a 30-day look back. That's where it becomes complicated. So, Care First after 30 days, if any ads or deletes come off, then the client gets notification the rates are either going to go up or go down accordingly. So, it's good for the right group, but again, it just brings in another complexity that for the right group that's trying to minimize all the different age banded rates, it's a good solution. So,
Yeah, because we don't, I mean, obviously there's a difference between local carriers and national carriers. We all have our strengths and weaknesses. And I would say we don't do a 30-day look back, and composite rates in small business is very much more the norm than the exception. Obviously with Maryland going age banded and ACR in, was it 1993, 1994? It's a little bit different of a situation, but yeah, so we're very flexible in that, because I would say composite is definitely more of the norm nationally. You do have some states like New York and California where age banded is prominent as well.
And is there a reason for these rates, the composite rates that weren't offered on exchange?
I would have to check back internally with underwriting actuary.
Same. I would have assumed, which is probably the bad thing to do, that it had to do with compliance, but that was, again, just something that I made an assumption on based on the fact that, again, our systems automatically default to composite rate, and it has to go actually flip back for Maryland groups. So, but I will double check that.
Okay, sounds good. We can get an update next time, next month. And one other update, thank you all for your comments. I do see a hand up actually, if it's about this before my update. Yes, Nikki.
And is this something that MHBE is looking to have in the shop platform for 2025? You're on mute, Mimi.
Oh, sorry. No, this wouldn't be for 2025 go live. We looked into it, and there was a lot more complications that go behind calculating composite rates. So we wouldn't be doing that initially at go live, but we're keeping it open for an enhancement if down the line, if it is of something that's something that groups require.
Okay, thank you.
Yeah. So just a quick update, and I don't have a slide about this, but we've discussed a few times about our new policies that are going into effect next month, or as of November 1st. So as of Friday, groups will have a lower participation rate requirement on exchange. It's going to be a flat 60% rather than different. I think most of the carriers had a 60% participation rate, minimum participation rate, but we've updated the regulations to now allow it to be down to 60%. And then also the waiting period requirements also going into effect November 1st, that it won't be longer than 60 days. So the 90-day maximum waiting period has now been reduced to 60 days. So these are all, I think, good and positive policy changes to allow groups to be able to enroll and not have their employees wait too long before, like 3 months of a wait before you enroll into a group plan is just way too long. So that's a positive change in my eyes. And then the participation rate going down to 60% instead of 75 is also a positive change in my eyes. John?
So the 60% participation rate, does that include a waiver for an employee who elects coverage on the individual market?
Yes, yes. I think we've touched on this in the past as well, but yes, individual coverage does it does meet the waiver requirement. So that is an eligible waiver reason.
Okay, thank you.
Thank you. Yes, Amber.
And does it have to be individual market on the exchange with a subsidy, or can it be off of the?
Any individual coverage is allowed.
Okay, thank you.
Yeah. All right, so we can now open it up for public comments. Glenn.
Has the Care First contract been changed? Because in the contract to Care First, it stated that it had to be an individual person on the Maryland Health Connection, not off the exchange. It kind of spelled it out on the actual contractual paperwork with Care First. Can
And
Care
I
First
believe
comment on
it had
that?
to have- Oh, sorry.
Sorry, Glenn. Contract for what exactly?
Well, in the body of like when I received I can't remember exactly where that contract, where I found that information on a Care First information, whether it was in the actual renewal, whether it was in the contract of somewhere I read it, and that was one of the carriers that would allow the individual to be a legitimate waiver, but some other carriers were not allowing it. So Aetna, for example. So I just want to have clarity if it's like what Mimi just said. So all carriers have to adhere to this new regulation. Is that what I overheard?
I can speak to just for on-exchange groups. I'm not speaking to off-exchange. For on-exchange groups, yes, individual coverage, regardless of whether it be on-exchange or off-exchange, they're an allowable waiver reason. So Glenn, you might be looking at their non-shop guidelines or something like that, and that's totally up to Care First to do that.
Got it. That's where I read it somewhere. So I was hoping maybe Care First, could you check into that, look into that for us brokers?
Would you mind following up with me via email? I don't want anything to get lost in translation, but all of our off-exchange policies are not the same as our on-exchange policies. Is the general sentiment. I just want to make sure folks understand, but I'm happy to look into a specific here if you wouldn't mind following up with me, because I'm a public policy person, not contracts. So I just want to make sure I get the right teams on it and I don't lose anything in translation. Or happy to hop on a call offline, Glenn, if that's easier. Yeah, I can put my email in the chat too.
That's what I was going to suggest. Thank you.
Of course.
Amelia?
Thanks. I just wanted to note on the record, giving appropriate credit to the meeting minutes. Appreciate John mentioning at the beginning of the meeting that the minutes provided are always so wonderful, and I totally agree. And as much as I'd like to take credit for them, just wanted to note on the record that it's our great partners at the Hilltop Institute that take care of all of our meeting minutes. So just wanted to shout that out, and thanks to the Hilltop because they are always really great.
Thanks, Amber. I mean, Amelia.
Yeah, I was gonna say that was Amelia. I'm agreeing.
And I somehow had access to this group guideline that Care First has, and I did find the line item that Glenn was referencing, but it is best for you all to just follow up offline. But it looks like they are referencing like off shop versus on shop. So Glenn, if you want to just take a look at their guidelines and reach out to Care First, that would be great. if there
Yeah,
are
thanks for letting me know. I remember reading it in the guideline and I forgot where I've read it, but you're absolutely correct.
yeah. All right, no worries. Then if there aren't any more public comments, then we can end the meeting, and we appreciate you all. Thank you for joining today, and we hope to see you next month.
Thanks, everyone. Appreciate all your contributions.
Sounds good. Thank you. Bye.
Thank you.
Thank you.
Yep.
Thank you,
Good
everyone.
job. Thank you.
Thanks.